So moving on to chapter 1, and probably one of the big revisions that you'll see this year to the guidelines is the update of the HIV infection guidelines. And when I read through this, I didn't really see where the intent of the guidelines had changed a lot, but I did feel like it streamlined things a little better. You know, I was just talking to somebody this week in training, and she was asking me, how do I know if it's HIV versus AIDS? And this really is helping to tell you which code to be using. And they put these terms in quotes. So code B20 is the code that is used when the patient has AIDS, which we a lot of times don't see documented. I think that the terminology has evolved over the years, and we tend to see HIV disease or HIV infection rather than AIDS. But just know that if they have had HIV disease, or they present with a condition resulting from HIV, or have documentation of a prior diagnosis of an HIV-related disease, you get code B20. However, the flip side of that is if they're documented as HIV positive, HIV test positive, or there's no documentation that they have or ever have had an HIV-related illness, then it gets a Z21. And then they go into the other guidelines. And this is covering about, I don't know, 8 guidelines on the 2 slides that I've got here for you. So definitely go and check it out. Just a reminder that the coding guideline changes will be noted in bold, and you can kind of see where the changes are. But I just thought it would be easier to give you kind of this infographic, if you will, so that you can see how each guideline plays out. If the patient is pregnant, they get the 098.7 first, and this is worth really paying attention to. So if you have a patient who is pregnant with HIV, the O code is sequenced first. The O code takes precedence. If they have documentation of an HIV-related illness, then they get code B20 as a secondary code, and then any codes for the HIV-related illnesses that may be present at the time. But if she's pregnant and HIV positive, no history of HIV-related illness, it's still the O code, 098.7, and then the secondary code is a Z21. So that's a guideline worth going in and reviewing. And then if the patient has HIV, is HIV positive, managed by antiretroviral medication, and there's no documentation that they have an HIV-related disease, it is a Z21. Now, the big thing to remember here, and there is a guideline that says this, is that you can go from a Z21 to a B20, but you can't go from a B20 to a Z21. Now, that doesn't mean that you can go back and look at old, what was coded on their last encounter. We have to code just with the information and the documentation that is for the current encounter that we're coding. But once they've had an HIV-related illness, they will always be a B20. They won't go back to a Z21.